What up, everybody? My name is Matty Willz, and welcome to our inaugural episode of a brand new series that we're kicking off starting today. It's called Wellbeing Wednesday with myself, Matty Willz, and of course, we are brought to you by MetroHealth, where we will talk to different people who work for the company about a very brand new and super important project that they're putting on right here locally. And today's first guest, our inaugural guest, is Dr. Julia Bruner, who has a host of titles, which I'll let her speak to in just a second. But first, thank you so much for joining us, Julia, or Dr. Bruner, I should say. And just welcome.
Yeah. Good morning, Matty. Thank you for inviting me to join and help with this inaugural event in relation to the Wellbeing Wednesdays. Um, you can call me Julia, please do.
Okay.
I'm a family medicine doc. I've been a family medicine doc for over 20 years. And now I am the Senior Vice President for Behavioral Health and Correctional Medicine. I've worked at Metro for that same length of time, and my clinic for many years was in the Broadway Health Center, which is in the Slavic Village.
Got you. So very well established in the community, I would say, and very passionate as well. I mean, you've been in it for decades, so there's got to be some passion in there. So again, just thanks for being here, and we'll just kind of jump into it. So one of the things, or the main thing that's going on with MetroHealth is you have a brand new facility in Cleveland Heights that will be opening soon or is already open.
So the Cleveland Heights Behavioral Health Center will formally open October 8th when the hospital opens. October 8th is the date where we will have patients that are over at the MetroHealth main campus center transferred over to the Behavioral Health Hospital, and we'll begin accepting new admissions to that hospital the following day. In the meantime, we've done a lot of additional transitions of clinical teams to the Cleveland Heights site. So our residency training program, so the young docs that are learning how to provide the best care to the community have moved over to Cleveland Heights for their outpatient services. And then there is a program called partial hospitalization that begins actually on Monday. And that program will allow people who have needs in relation to their mental health that they require more than just a visit with a doctor or a psychologist maybe once every couple of weeks. They need something more intensive where they actually get seen and taken care of every single day without having to stay in the hospital.
Got you. So first of all, whenever Cleveland Heights is shouted out, I got to remind everybody that I'm a Cleveland Heights High School graduate, class of 2001, not too long ago. But what was important about Cleveland Heights, and why did we basically kick off and invest in that area?
When we looked at the market and we looked at the availability of health services across Northeast Ohio, we saw that there was a gap in Cleveland Heights in relation to access to mental health care services and addiction services. And that campus had space that we could build something new and attach it to what was already there. And that was an opportunity that we just couldn't pass up in relation to serving the community.
Got you. So when we talk about inpatient behavioral health hospitals, I just want to give the folks a clear understanding of exactly what it is that we're talking about. So can you kind of just dive into that a little bit?
Yeah. So I think it's important for people to consider that your mental health is as important as your physical health, because your overall health and well-being isn't just one of those parts. It's all of those parts. And so when you have a condition that requires close supervision and close support from nurses and clinicians and doctors, you need to be in a hospital. And it doesn't matter if it's because you had to have surgery for a gallbladder, or because you need that care because you're feeling suicidal, or you're feeling and seeing things that you know aren't real and you want to get it taken care of. And so that's the point of that inpatient stay. We need to ensure that people understand that health is more than just their physical health, more than
Mm,
just the organs that are below their neck, right?
right.
So that's I think one piece that I would encourage people to understand in relation to their health and well-being. That
Right.
that the inpatient stay for psychiatry can be necessary, and it's an important thing for you to do.
For sure. For sure. Thank you for doing that. So kind of made it easier for me to grasp as well. Sometimes I need things broken down a little bit. So when we go to the doctor traditionally and somebody says that they're depressed, before maybe before this facility was around, or what would a doctor typically say to a patient?
So if someone's feeling depressed, we often will ask more questions like, how often are you feeling sad?
Mm,
What are the things that you're thinking about? Have you had this happen before? Is this something that you've seen happen in your family? Um, because all of that information helps us understand what your needs are as an individual in relation to your care. It also helps us understand, if someone in your family has had treatment for depression and they've had successful treatment for it, that often helps guide us in relation to the types of medicines that we will start for you if that medication is indicated. The other piece that is important in relation to treatment for um, behavioral health issues is to look at it not only as a um, medication component into relation to your treatment, but also in relation to therapy. And so all of our primary care practices at MetroHealth have what we call integrated behavioral health. And what that means is that the patients have access to counselors, have access to psychologists in relation to supporting them along their journey with their health. And that journey could include, I'm having a hard time managing my diabetes. And you can give me all the medicines you want, but if I can't figure out a way to change my lifestyle, I'm still going to struggle with that diabetes.
for
And
sure.
so the integrated counselors can help people find the right things that they can do mentally to help them get down the right path in relation to health choices and health decisions around their lifestyle.
Got you. So I mentioned before, I grew up in Cleveland Heights, went to school in Cleveland Heights. How are we integrating this into the schools, not only in Cleveland Heights, but just, what is the
Yeah,
plan moving forward for the
yeah,
for the young people out there?
yeah. So Metro for over a decade has been involved in school-based health.
Mm,
And one of the missing pieces in relation to that school-based health was really ensuring that the adolescents, had access to mental health services. And so our Institute of Hope and our school-based health program is building out that team in relation to licensed counselors that will be available to students uh, at the schools that we're at, so that they can get the treatment and support that they need.
got you. Thank you so much for that. Now we're moving around. I want to just remind everybody, this is going to be the first of many episodes. So we're trying to cover like all of the bases, and moving forward, we will kind of have more episodes geared towards specific things. And so just if you have any questions, we'll offer opportunities for the people who are watching us and listening to forward those to us so that we can pass those along to you as well. But again, we're just trying to get all the bases covered so we can get a nice smooth rollout here. Job opportunities. Do you guys have any? Are there any entry level positions opening? Everybody kind of need a job right now. I got a 16-year-old that I cannot wait to start working, but go ahead.
um, the 16-year-old, not quite in relation to jobs, uh,
Okay.
but uh, but yeah, we have opportunities across all levels in relation to education. Uh, Additionally, that we're building out programs that support people in relation to expanding their skill sets, developing themselves while they're working to get to that next level. So that may be in relation to supporting someone for tuition reimbursement relative to going to school. That could also mean, you start at this level in relation to your hire, your hiring point. So let's say you're coming in as a social worker, and you're working towards getting your independent license so that you can be a counselor. Well, guess what? We're going to make sure you're tied to an independent licensed social worker, so you're getting that experience that you need, so that you can then go on to that next level. So we're creating what we call career ladders within MetroHealth for the staff. We've done a number of job fairs out at Cleveland Heights that have been very successful in finding people from the community that want to work at Cleveland Heights Behavioral Health Center or at Cleveland Heights campus in general. So I'm really excited about the staff that we're bringing on. They're motivated, they're dedicated to patients. They want to serve their community, and they want to serve their community in a very successful way.
So I'm super excited about not only obviously the job opportunities that you guys will start affording people, but just the entire ordeal. I love the community of Cleveland Heights, but I also love the community, this kind of newfound community over the past few years of this strive for people to recognize that there are behavioral health issues out there that need to be addressed. And with that being said, we kind of touched on our main points, but I want to close with why, because this was interesting to me. So what is the purpose or the focus behind, you always hear what we're talking about as mental health, but we're making a shift in how we describe it and how we label it. Is that a concentrated effort, or can you just kind of dive into that a little bit?
Sure. So I think the reason why we're changing the language around mental health has to do often with stigmas that are associated with those terms. And when you look at the broader context and we start using the term behavioral health, that encompasses some of those lifestyle changes that I was just talking about relative to diabetes. That encompasses maybe there was a significant trauma that occurred in someone's life, and you want to be able to support that and get them going down the path that they want to go down, and not have too many barriers in front of them for that. So behavioral health is meant to encompass not medical or mental health conditions that should have medicines to help treat them, but also in a broader way, ensuring that behavioral health is supporting that individual's health overall.
Gotcha.
Does that help, Matty?
That does definitely help. And trust me, I will be asking you that probably once an episode or whoever comes on, just because I agree with it. It took some convincing for me personally, I'll just admit, because I didn't realize that there was a stigma associated with it. But when I kind of took a step back and thought about it, I believe that there is, and I appreciate that we're doing something actively about it, just to get people, however they want to address these situations for themselves personally, just to get them to do it. So I definitely appreciate and I understand why that shift is going on.
Yeah, we need to meet people where they are so that they can move forward.
For sure. So thank you so much again. That's Dr. Julia Bruner. She says I can call her Julia, so I'll say Julia. Thank you so much for hanging out with us today. And of course, the inpatient, I want to get this title right. The Inpatient Behavioral Health Hospital in Cleveland Heights will be opening in October. Of course, we'll keep hammering the date down and passing that information on along to our listeners and viewers. Thank you guys for watching. And we will be back soon on another Wednesday with another episode.
Thank you.
Thank you so much.